Hello, welcome to Genes and Journeys, bridging gaps in medical and societal accessibility, where we are going to take a deep dive into participation in science and future of healthcare. My name is Estefania Costa, and I am with the network of the National Library of Medicine. Before I introduce our moderator, Caroline Nickerson from SciStarter, I'd like to encourage everyone joining us live to ask questions through the chat. For chat moderation, we follow the NIH common guidelines. Our team will be monitoring the chat for the duration of the discussion. We will love to hear from you, and our panelists will respond to as many comments and questions as they can. Due to time constraints, we may not be able to get all the questions. We are excited to offer closed caption in English and Spanish and ASL interpretation. You can message our team in the chat if you need assistance finding captions or have any other technical issues. If you are not able to stay for the entire discussion, you will find a recording of today's conversation on NNLM's YouTube channel. Now, allow me to introduce my colleague, Caroline Nickerson. She's an advisor at SciStarter, where she assists with the Citizen Science Month program, SciStarter corporate volunteer programs, and other programmatic and outreach efforts, including working with SciStarter's syndicated blog network, which encompasses the Discover magazine and SciStarter platforms. She's a passionate leader committed to bringing science to everyone. Welcome, Caroline.
Hello, everybody. I'm so happy to be here. And just welcome to everybody who's joining us live. Welcome to people who are watching the recording. So today's event is part of Citizen Science Month, which is a global effort each April to move scientific research forward. And today's event is also underneath the umbrella of the 1 Million Acts of Science, which is our campaign for Citizen Science Month. So if you use the hashtag 1 Million Acts of Science to talk about how much you're enjoying this event, or to talk about the different citizen science activities you're getting involved with, SciStarter will make sure to celebrate you on citizensciencemonth.org. So I always like to plug that hashtag as a way of helping build the community. The great news is we already met our goal. Over 1 million people participated in citizen science projects like All of Us and Project Sidewalk, both of which you'll learn about today, and attended events like this one that we've been hosting with our friends at the network of the National Library of Medicine. So citizen science, also known as community science, is how anyone, anywhere can move scientific research forward, often by collecting and analyzing data. SciStarter is the world's largest citizen science organization. We host a database where you can discover thousands of citizen science projects, events, and tools, and we're a proud partner of NNLM and All of Us. We view events like these, where anyone can engage in dialogue with experts and community leaders, as an integral part of our mission. I'd like to give our panelists the opportunity to introduce themselves and share something exciting they're working on. So Dr. Watson, we'll start with you.
Watson, I'm the Chief Engagement Officer for the National Institutes of Health, the NIH All of Us Research Program. One of the exciting projects we continue to work on is the All of Us Research Program. And what's really exciting is our opportunities for programming like ancillary studies, where we're seeing people like citizen scientists to inform the work that we're doing for projects such as nutrition for precision health, where community members are saying what areas are important to them and how they want to see the All of Us Research Program drive that work forward. Thank you so much.
Thank you, Dr. Watson, for being here. Up next, I think we're going to pass the mic to Devin. Devin, tell us a little bit about you.
Hello, I'm glad to be here. My name is Devin Anderson. I am the engagement coordinator with the American Association on Health and Disability, and we are also working on the All of Us Research Program. And one of the things that we are formulating at the moment is proxy consent, and how folks with disabilities who may not be able to consent on their own, we can work through their loved ones and their caregivers and allow them to give consent to be a part of the program. Folks with disabilities are often overlooked in research, and we are looking to change that. Thank you for having me.
Amazing. Yes, Devin, I think you're very much in line with our theme of genes and journeys today, the spotlight on equity and accessibility and healthcare and citizen science. It's very exciting. I can't wait to learn from Devin during today's conversation. Up next, we have Charity.
Hi, my name is Charity Ricker, and I am an assistant professor of clinical medicine at USC and also the director of the genetic counseling program at LA General Medical Center. And one of the exciting projects we're currently working on is developing an animated computer character, which is called a relational or conversational agent, that will provide genetic education to patients with cancer. And we hope that this animated character, which speaks both English and Spanish, will overcome some of the barriers that patients face when accessing genetic services across the country.
Inspiring. Oh, I can't wait to ask you more questions about that. And then later today, we're also going to hear from John when he's able to join from Project Sidewalk. We have him geared up last because it's just Project Sidewalk is such an inspiring citizen science project where folks are able to help increase accessibility in terms of our cityscapes, and they can participate from anywhere to classify data from different cities. So later you'll also hear from John. And for all of our inspiring panelists, the fun is not just in this event. Each of them recorded a 10-minute or so talk that you can view online separately. If you haven't already watched it, it's going to be included in the follow-up email from today's event. So I hope that helps enrich your experience of this event and helps deepen your engagement with each of our panelists. And we're going to be playing clips from these talks today to help enrich our conversation in the actual Zoom room. So today, we're talking about citizen science, community science, equity in healthcare, genetics, public participation in scientific research, accessibility, and so much more. And like we said at the start, we really want this event to be a conversation. So we want you to use that Q&A feature if you're live with us on Zoom. And if you're watching on Facebook, you can go ahead and head over to the Zoom at any point. The short link is bit.ly, bit.ly/, all of us Zoom, all lowercase, if you want to join. And I think it'll be a very impactful conversation. So for those on Facebook, I encourage you to come on over to Zoom so we can get your questions, and we'll try to get to as many as possible. So our first panelist is Dr. Watson. We're so grateful to him for that introduction. And we're going to play a short clip from his pre-recorded talk explaining what the All of Us research program is. Then I'm going to ask him a few questions and some things I want him to expand on. And at the end, we'll take questions from all of you. But Richard, if you can go ahead and roll the clip of Dr. Watson's All of Us overview, that would be great.
So what is the All of Us research program, and what are we setting out to do? We are setting out to engage 1 million or more people over the next 5 years to create one of the world's largest and most diverse data sets that truly reflects the diversity of the U.S. We want to collect data and make that data available to researchers so that they can ask questions that they have not been able to ask before. We want to make sure that we're not only collecting data that is biological samples that may include certain things that allow us to look at genetic ancestry. We also want people to complete survey data. So we ask questions about social determinants of health. We also want to be able to look at the EHR, the electronic health record, so we can be able to look at someone's health history at one period of time and see how it may change over time. So imagine the rich ability to be able to combine those types of data together. And as a result of our intentionality around diversity, equity, and inclusion, we have created one of the world's largest and most diverse data sets that is truly reflective of the diversity of the U.S.
All right. Well, that was very exciting. And so, Dr. Watson, you mentioned this term, social determinants of health, in your clip. Can you tell us more about what that means and how it ties into the intentional collection of data through All of Us?
Sure, Caroline. Thank you so much for that question. When we hear the term social determinants of health, I think really the definition of it is in the term social. Those things, we often say where a person lives, where a person plays, where they work, what they eat, what they have access to, even the stress that we can be under, are all things that can determine our health outcomes. I used to do a lot of my work in the Chicagoland area, where in different community areas and different neighborhoods, you could have different disparities. We have a major train line system here called the CTA, the Chicago Transit Authority. You can take in 2 different train stops. You can get on the train at one location, and 2 train stops away, someone's life expectancy can decrease by as much as 20 years. So when you think of that, that's an example of a social determinant of health.
Fascinating. So to switch gears a little bit, you lead engagement efforts for the All of Us research program. Can you tell us a little more about why those efforts are directed at populations that haven't been represented in healthcare research and how these efforts hope to change healthcare?
Thanks so much for that question. When I think about populations that have been historically underrepresented in biomedical research, it's those populations that often carry the greatest burden of disease, whether it's racially ethnic minoritized populations, populations that may self-identify as being a member of a racial or diverse racial or ethnic group, populations living with disability, populations who are maybe sexual and gender minority populations, and also populations that get their care in community health centers. Historically, research has often taken place in your big academic medical centers, but we know that patients and community members get their care all over. For example, when you think about cancer, although so many Americans are unfortunately now living with cancer, but we're still at only about 5 to 10% of those eligible for cancer clinical trials participating in clinical trials. So we really want to make sure that people have access, awareness, and accessibility to clinical trials, and that those trials are designed in a way that won't exclude populations historically underrepresented in biomedical research.
So I'll ask one more question. This is a little off script, but I just got curious about it. And your talk was so inspiring about your personal story. I think personal stories really help us understand these points. So we hear like about these big groups of people that All of Us is including. Can you tell us about some of the individuals that you know have been included through All of Us?
I can definitely tell you about some of the individuals that have been included in All of Us. I remember there's two participants that come to mind. One is as an African-American participant in the California market. And I was on a call, a recent workshop with partners in California, and they had a participant come on board. And she said it was important for her to join the All of Us research program because of her lived experience, because her mother was impacted by a rare condition, and her family did not know a lot of information about that rare condition. And I'm so happy we have genetic counselors that are and the importance of genetic counseling, because even my own family, when you don't know that the genes that you inherit or the DNA that you have can put you at elevated risk for certain conditions, and you don't have anyone to talk to about, are there things that I can do to minimize my risk? So having this particular participant tell us that it was important for her to join was so important. And I also think about participants like Hugo Campos from our California market that talks openly about his heart conditions and the rare condition that he has, and how research hasn't always been able to answer certain questions for him. But that's why participants like Hugo and the other participant from California remind me of the importance of having programs like this so people can learn about their health history and also the history of their families and how their data can help advance research and move it forward.
That is fantastic. I think that's such a good segue for our next speaker, Devin, talking about, equal representation in research. That was the focus of Devin's talk. So I think for Devin, let's roll a clip from her longer talk about the All of Us research program and equal representation in research.
The disability has historically and continually been left out of health research, and the All of Us research program really seeks to change. All of Us honors the disability movement's central mantra, which is nothing about us without us, by inviting people with disabilities to contribute to research findings that may lead to more tailored healthcare for them and others in the future.
I love that mantra, nothing about us without us. So Devin, if you could tell us more about how the All of Us research program brings those critical voices and perspectives to the table.
Well, thank you for asking. So we took some liberty with the nothing about us without us line, and we made our phrasing as no research about us without us. And we really do put forth a lot of effort to engage with the community with disabilities. We understand that they are highly underrepresented when it comes to research for various reasons. Accessibility, like Dr. Watson spoke of, there are tons of social determinants of health that determine, who gets healthy and who stays sick. And that is not, the disability community is not immune to that. So we really do try to embody that message of, we need the research to be at the table. We're working on developing precision medicine. We're not looking to cure disability. We're looking to learn more about it and really help people figure out ways that they can live more productive lives, and just understand more about their own background and their own genetic history and what they could be, carrying for future generations.
Definitely. So you work for an organization, AAHD, the American Association on Health and Disability. Could you tell us more about that and how y'all work with all of us?
Yeah, so starting in 2018, we started working with the All of Us research program as an outreach partner, and we're currently in the lead of a network of about 20 national and local disability groups in this effort. So we work with NAD, for example, which is National Association for the Deaf, is one of our cohorts, and we work with them to sort of continue things like, since I'm in outreach, for example, events, we support them with events, we support them with any outreach they have, social media needs, any sort of media like that. And with our inclusion statement coming out in 2022, which is the No Research About Us Without Us, we are developing these relationships with people across the country who are in the disability community, and really sort of trying to get them to get tailored information for them when it comes to their own journey. And without our partners, that we work with, we would not be able to be as successful as we have been, and we're hoping to just continue it in the future.
Fantastic. And I'm seeing lots of fans in the chat. Someone said AAHD is wonderful.
Oh, thank you. I think so too.
Fantastic. And
Good.
we'll pose more of those questions to Devin once we get to the larger panel where we're able to have more questions come in. But up next, we got Charite. So we have a short clip from Charite's lightning talk that explains we've heard the word genetic counselor a few times so far in this program. Charite is going to actually tell us what genetic counselors do and what people could expect from such a visit. So let's go ahead and roll the clip.
As a genetic counselor, my goal is to educate, guide, and support families and patients who are trying to understand how genetics might contribute to the cancer they have or the cancer that they see in their families. When someone comes to have a visit with us, we often start by drawing out their family tree and reviewing their personal and family history. This history is important because it helps us know if there could be a test of their genes to better understand this history.
So interesting. Okay, so Charite, I'm a recent participant in All of Us, so I'm looking forward to getting my genetic test results. So could you tell me a little bit more about how these genetic test results might be used for someone's healthcare?
So in particular, because I work in the context of cancer risk, we know that most people who develop cancer do not have it because of something inherited, but a small percentage do. And these families face incredibly increased risk. And so that the typical screening and prevention that is recommended is not sufficient. So by understanding if somebody has a higher chance, their healthcare providers are better able to personalize a prevention and screening plan that fits their level of risk. And also by understanding if that isn't contributing to cancer in a family, we can sometimes allow people to be less anxious or concerned about cancer risk. And sorry, I focused on cancer, but this can apply to many other settings and situations, like Dr. Watson mentioned, cardiovascular or heart disease. It can apply there, and there's other genetic conditions where a test might guide how a healthcare provider follows or cares for a patient.
Wow, that's so empowering. The fact that getting these genetic test results can help empower, your healthcare decisions and maybe make you a healthier person or make you more able to prevent negative outcomes. So you've done work specifically to address unequal representation in genetic research. So can you share some examples with us and talk about why this diverse representation is so important?
Yes, this is one of my favorite topics, so I will try to keep it brief. But one project that I'm currently very excited about, which has a long name, is called the Center of Optimizing Engagement of Hispanic Colorectal Cancer Patients in Cancer Genomic Characterization Studies, which is a mouthful, or COPEC. And essentially, we know that there's important, unique changes that can happen in tumors that are important to helping us find new treatments and also help understand if somebody's going to respond well to a treatment. However, very little is known about those specific changes that happen in tumors in individuals who are Hispanic or Latino. So the major focus of this study is to gather information and better guide future treatment and care. And even though much less common, less is also known about the inherited component to colon cancers in our Hispanic Latino communities. And so by looking at the genetics of the tumor and looking at genetics of our participants, we hope to guide future care in our communities. In addition, one of the things that I love best about this project is it's not just about the science, but it's also about engaging with the patients and participants themselves, and then incorporating their voices and feedback into the way that we do our research, so that hopefully that makes it more translatable in the future and their voices are represented. And so without diverse representation, we cannot ensure that the findings that come from our research are going to be personalized and able to be benefited from for other communities.
Fantastic. Yes, inclusion is so powerful. So thank you for the work you do. Last but certainly not least, we have John from Project Sidewalk as our next speaker that you're going to hear from today. So the other speakers you heard from, they're the genes part of the event, and John's more of the journey part with Project Sidewalk. But we thought it was important to include his project as well, so we could think about accessibility from all sorts of different angles, including on the streets. So let's go ahead and play a clip from John's talk, and then we'll get to hear from him. So let's roll the clip.
So my group is pursuing a twofold solution. First, to develop scalable data collection methods that mine massive repositories of online map imagery, like satellite imagery or streetscape imagery that I'm showing here, using a combination of crowdsourcing and machine learning. And second, to create new urban analytics not previously possible. For example, in a beta version of our tool Access Score, which I'm showing here, users can get an at-a-glance custom view of the sidewalk accessibility in their city. Our overarching goal is to map, assess, and visualize every sidewalk in the world by creating scalable human AI crowd techniques. And we have been long working in this space. Each paper here represents a scientific publication advancing work in this area. Research that has significantly relied on community engagement and community science through a tool called Project Sidewalk. Project Sidewalk is an open source crowdsourcing tool for sidewalks, available at projectsidewalk.org. We invite you to try it out. And we're proud to be featured on SciStarter, which is a platform for finding and contributing to community science. You can even earn credit in the SciStarter dashboard for participation. So Project Sidewalk combines online map imagery, remote crowdsourcing interfaces for labeling and validation, and machine learning to scalably map and assess sidewalks. And there's a variety of key outcomes. So working with our partners, Project Sidewalk is being used to improve urban planning, build new interactive visual analytics, and improve government accountability.
Wow, Project Sidewalk. So John, could you tell us a little bit more about the project and how people participate?
Sure, thank you. And thanks so much for having me here today. So Dr. Watson talked about the social determinants of health. And if you think about health holistically, you also think about the environmental determinants of health. So where we live and the environment around us can actually have an impact on our health and certainly our mobility. And so that's really the focus of our group. Though I am a computer scientist, we're developing computational techniques to try to analyze the built environment to potentially help researchers like Dr. Watson, or actually my collaborator, who's Dr. Eisenberg, who's on this call, who deeply care about public health issues, equity issues, and its relationship to the built environment. So Project Sidewalk is a new type of tool that allows people to visit projectsidewalk.org. So you can do this from anywhere as long as you have an internet connection and a laptop, and virtually see imagery of the physical world, and then analyze it for barriers that might impede people who are using a wheelchair or other mobility aid. So it's immersive streetscape imagery, and you sort of walk down it or move down it as if it were a video game and say, oh, well, that curb is missing a curb ramp, right? So it doesn't have street level access. Or that tree is in the middle of the sidewalk, and that presents an accessibility barrier. So the environment itself becomes disabling, not one's ability. So that's the key part of Project Sidewalk. Now, we mentioned that it's on SciStarter. The key part here is community involvement. We work with people with different types of mobility who can access our website, or really anyone can access our website through SciStarter or just going to projectsidewalk.org and using the website to label and find these accessibility problems. And then they can earn different kinds of rewards on SciStarter or on our website too, through badges and leadership board and so on.
Wow, that's so exciting. So I think we have a pretty good understanding of how to participate in Project Sidewalk. So let's hear about some of the policy outcomes and some of the impacts so far. So we have a clip about that from John's larger talk. Let's roll the clip.
As a result of our data, the Newburgh City Council established a new sidewalk renovation program in the region, including the authorization of $50,000 for immediate sidewalk repairs on city property, and established a sidewalk accessibility grant program to help homeowners fix sidewalks outside their homes.
So John, could you expand on that a little bit? Talk a little bit more about how important it is for all of us to contribute to data collection so we have outcomes like the one we just heard about?
Yeah, and my apologies to Brandon for speaking so quickly in that clip. I think you did a wonderful job trying to interpret it. Recently someone shared a story with me about the built environment, and I thought it was such a great anecdote. I want to share it with you. So sidewalks are really critical to mobility in cities and even rural areas. They connect us last mile, first mile to transit services. They're often utilized as a primary pathway to schools and education, libraries, and certainly parks, right? So it's not just about economics or access to education. It's also about quality of life. And so I want you to imagine that you determine that there's a giant pole that's in the middle of your road, right? And you call the city and you say, there's a light pole in the middle of my road. And I've seen a couple of cars crash into it in the last 24 hours. How quickly do you think the city would deploy people to actually start to fix that, right? Where when it comes to our sidewalks, unfortunately, where we actually see some of the same types of barriers that affect all of us, whether or not we're carrying luggage or pushing a cart or in a chair rolling along, that dramatically impact our mobility. So I think the key is we need data, we need community partnerships, and we need local government to help us make change. And we do that through a very data-driven oriented fashion.
Fantastic. So I think we got a great overview of genes and journeys. You heard from folks involved with the All of Us research program. You got to hear from John about another citizen science project, Project Sidewalk. Let's pivot back to All of Us for a second. And I'll start off with a question for Dr. Watson. So we've talked a lot about research, which I think feels like a scary word for a lot of people. We feel like we're not qualified to do research, but we're talking this Citizen Science Month about how we can all be a part of research, no matter our background, through projects like the All of Us research program. Can you talk a little bit more about this and what you want to demystify about participating in citizen science generally and All of Us specifically?
Sure. Thank you so much for that question. When I think about how we want to demystify the research project, I start even be inclusive of citizen and community scientists. I often have to start with conversations about what research is. And I start with very simple conversations that people have. My family, like many families, are dealing with diabetes. We know that many of our families have high blood pressure or hypertension. And so when I run into communities and they say, I don't want to be a guinea pig, and I hate that term, but they say, I don't want to be a guinea pig. I don't want to participate in research. And I asked them a very simple question. I said, have you ever gotten a prescription from a doctor, a nurse practitioner, or any other provider? And they say, of course I have. I said, and that prescription was, you had to go take it to a pharmacy and get that prescription filled. And they say, yes. I said, well, guess what? That drug that you took for your diabetes, I said for your allergies, if it was prescription, and it was FDA approved, that drug went through the process of clinical trials. It went through a process where it was tested in a safe space, where it was looked at for its risks and its benefits, And then it determined what the safety profile was, how effective that drug was, and then that drug came to market and it got to people like you. So then this is where citizen scientists come in, because that's still a very scary process, even though I walk our participants through that. When I was in the Chicagoland area doing my research, I talked to African-American men all the time, or other men from other populations, about the importance of colorectal cancer screening. But imagine if your barber, who you see probably every Saturday. I don't see my barber anymore, but every now and then I go in for a shave. But if you see your barber or someone every Saturday, and that person is used to talking to you and they speak in everyday terms, and that barber says, hey, I know you're here to get your hair cut and it's your 50th birthday or it's your 45th birthday. I saw something on the news where the American Cancer Society talked about new guidelines for lung cancer screening. Have you had your colonoscopy this year? Have you talked to your doctor about whether you need a colonoscopy or you can qualify for some other study? And that barber would have way more success in reaching that person because of the trusted relationship that they have. And so imagine if that person were then to enroll in all of us. And like my colleague said, who said that, while most cancers, fortunately, if you think about cancer, aren't due to family history, but when you have a family history like mine, where I lost my brother to complications from colon cancer before the age of 60, I was scared. And so what joining the All of Us research program did is it connected me to a genetic counselor. It allowed me to see that I did not have one of those genetic risk factors for colorectal cancer, and it allowed other researchers to see how I compare to other people who are impacted by colorectal cancer based on my electronic health record, when I got my colonoscopies, and other things that's in my data set. So all those together are ways that citizen scientists and the All of Us research program are moving this work forward.
Fantastic. On the subject of demystifying research, I feel like, John, if you want to give any commentary on that from the Project Sidewalk side. I know sometimes when I'm talking to citizen scientists at SciStarter, people are nervous to participate. Are they worried that they'll classify the data incorrectly? Could you give any words of advice to them and help demystify the whole process?
Yeah, I mean, I really like Dr. Watson's response as well, in that, sort of every day we're experimenting, we're hypothesizing, we're doing the types of things that scientists do. And in Project Sidewalk, we kind of break these things down for people and try to help them. We assume that you actually haven't really assessed the built environment in the past, and certainly not with the lens of disability. And so we try to train you into that interactively, just like when you download an app on your phone, it tries to do little pop-ups and it's like back in my day, we used to have manuals. Well, no one reads manuals, right? So it sort of needs to be inherent into the community science process. But there's a long stream in research, right? And a lot of times it does start with questions, right? What are the kinds of questions we have? Well, in Project Sidewalk, it is, what is the state of the built environment and how does it disable others, right? But along those lines, the next phase might be collecting data to sort of address that question, right? And then data analysis and visualization and visual analytics, and then some level of presentation and communication. So Project Sidewalk, most of the stuff sort of leans towards the left of that spectrum, but we've recently worked with the Girl Scouts in Oradell, New Jersey, for example, who did the entire stream, where they worked with us to analyze their city. They presented and they analyzed the data, and then they presented multiple times to the city council. So they were involved in a sort of political movement to build awareness and to try to persuade leadership within their communities that sidewalks are important and they need to be addressed and fixed.
Fantastic. So with All of Us, to pivot back to All of Us for a second, I think it's a really unique project in that participating can help people on a population level in terms of increasing inclusivity of research and contributing to this big study, trying to get big results. But it can also improve your life on an individual level or empower you with more knowledge. So I was thinking maybe we can talk through the process of participating in All of Us, especially because I'm looking at the chat and some of the questions that people are submitting, and they're curious about how to participate, or if they have participated, the process for getting those DNA results back. So I don't know who wants to grab this one. Maybe Dr. Watson, if you don't mind, and then we can pivot to Devin and Charité to expand on it. But what is the process of participating in All of Us, and what can people expect as part of that process?
Sure, thank you. And it's really important to hear from Charité when I talk about the return of results. So there's multiple what we call multiple ways that people can be enrolled in the All of Us research program. One of those ways that people can be enrolled is by going to finding out one of our sites that is affiliated with an academic medical center or a university. Like, for example, in the California area, you see Irvine as one of our partners. And so if you're in the Irvine area, you can find out what are the hours to find out about joining the All of Us research program. And then if you were to go there, you would go through a whole process where you will walk through a consent form, the informed consent process, which we don't just say the form, we say the informed consent process, because it's more than just a form. It's where you're told about the risks, the benefits of participating in something like the All of Us research program. And then if you agree to participate and you're at a site, then you can decide, how do you want to have your journey? Do you want to provide blood if that's available, or spit or sputum if that's available, so that we can look at things about your genetic information, your DNA, and your ancestry? Or you can decide if you simply just want to donate your electronic health record data, or simply right now you just may want to complete surveys. All those are ways, and we hope that people join and they want to go through the full process of donating a biological sample, which may be blood or saliva, completing surveys, and then donating their electronic health record. And then once you do that, your data is cleaned. It's what we call de-identified, meaning that no one will know that Kareem Watson is a participant in the All of Us research program. I'm given a number, and that number protects my safety. That data then goes to a central warehouse where it's analyzed. And then from that data analysis, it's sent to another opportunity where researchers can then get access to that de-identified data. And then lastly, what I'll say is that for just recently, the program reached a huge milestone in that we returned data to over 100,000 participants who have been in the program. And I know that some people have been in the program since 2018, and it's been frustrating for some of those participants to get that data back. I was one of those participants, but I finally got my data back, and something amazing happened. I got access to a genetic counselor. So any participant in the All of Us research program that gets their findings returned back to them, whether it's the medicine and DNA report, meaning how certain genes and changes in those genes may impact how you metabolize or how your body breaks down a certain medication or uses that medication. We call that report medicine in your DNA. Or you can get another report about certain findings that may be actionable, meaning that you can go talk to your primary care doctor about that. And all those findings are returned, Caroline, through the process of you speaking with a genetic counselor for free. And even if that genetic counselor, even if that data says that there's additional steps that you may want to take to talk to your primary care provider or your doctor, your family, you can get a clinical confirmatory test, which is a test that can say that these are additional steps you can make. And so that's kind of a snippet or a snapshot of the journey through the All of Us research program. But then you can also go to joinallofus.org to learn about other ways you can join the All of Us program in the event there's not a site next to you. And last thing I'll say, for example, Devin and the American Association of Health and Disability are huge partners with us through our All of Us journey, which is a van or mobile engagement unit that goes across the country in places where we may not have enrollment sites, talking about the importance of research and giving community members the opportunity to engage and ultimately enroll.
Amazing. So I think you gave us a great overview of how someone gets involved and how you can enroll. So let's say you got your results back. And now you're going to the genetic counselor. I think it's time to call on the genetic counselor in the room to tell us a little bit more about how that whole process works. So Charte, over to you.
So I'm not a genetic counselor in the All of Us program. And so, but I do know a little bit about what that process looks like. But please, those of you who are more closely associated, jump in if I misspeak. My understanding is that you get prompted and then you're able to make a telephone appointment with that counselor who will then review any, like Dr. Watson said, any clinically significant findings, and then talk through next steps around whether another test is needed to confirm those. And then at that point, I believe that that information is shared back by the participants with their primary care providers, so that information is able to be used in their care. I can speak a little bit to as somebody who is a clinical genetic counselor, what that process looks like, which can either be a telephone consult in a similar way, or sometimes in person. I know at our facility, about 60% of our patients actually prefer to come in person to sit down and have those conversations about whether or not testing is indicated and what kind of the pros and cons of doing a test are and how that test may impact their care.
Fantastic. So I think we've gotten a really good understanding of participating in projects like All of Us at the individual level. So let's pivot to the community level and hear from Devin. So Devin, I know no community is a monolith. There's so much diversity within the community of folks with disabilities potentially. So could you tell us a little bit about how AAHD approaches these diverse perspectives within the disability community to form these partnerships, and how citizen/community science can involve the disability community?
Yes, thank you for asking. First of all, back to Dr. Watson, we are, because there are a lot of areas in this country where access to the health, the academic resources, and the academic search, or rather research houses are not available or accessible. I just had the opportunity last week to spend the day with our journey bus in Columbus, Ohio. And so I got to see front and center how it worked. And I think that when you're looking at people with disabilities, a lot of the concerns that they have around health research is just making it accessible. So I know that Dr. Watson had spoken about the fact that some people just can't make it in person, be it mobility issues, be it location, all those social drivers of health, right? That can be stacked up against people. So I just happen to have mine with me. I am a member of the All-of-Us Research Program, and this is the box that my saliva collection kit came in. So you can go to the website and sign up, and they'll send you a kit. I've already completed a bunch of surveys. I'm waiting on my results, which I'm so patient. It'll be like Christmas morning and I'll just forget. And then one day it'll come in. I'll be like, oh yeah, there it is. So I look forward to that. But I think it's really important to remember that not all disabilities look the same. And, if you've met one person with a disability, you've met one person with a disability, right? There's not always common threads. In fact, there's hardly ever any. So what I love the most about the All of Us Research Program and the work that we do is that we really try to make it accessible for everyone. We've opened up a conversation series here at AAHD where we are hosting pretty much the schedule currently is about bi-monthly. We're having webinars dealing with the disability community and issues that or concerns rather that might come up within that community. We have one tomorrow over long COVID and disability. And we invite people to come and join the webinar and just learn more from a panel of experts on maybe aspects of disability they never thought of. We had on intersectionality and what it means to be a Black person with a disability, or any one of like a queer person with a disability. There are so many caveats of disabled life, and it never just looks like one thing. And so we really are trying to make the program and our partners engage with the community just on the individual level. Again, I know you said there's no such thing as a monolith, right? And so I think that is one of the biggest takeaways that I have found in my work is that, it can look a bunch of different ways. You can have communities of all different stripes. And as long as we can continue to make it accessible for them in whatever way we can, we definitely are going to. So we also offer office hours. So after the webinar on Thursday, we have an open office hour for an hour where people can come in and drop in and ask us any questions maybe that they didn't get answered, ask us questions about the All of Us Research Program itself, maybe how they can get more involved if they're interested. And so we really do like to keep an open door as much as possible to continue to engage with them on whatever level that they need engaged with.
That's phenomenal. So I think we've heard from all of our speakers how folks can get involved on an individual level. And then Devin talked a little bit about engaging community members, especially from the disability community. I saw an interesting question come through the chat, which I think ties into this theme of community. So one person mentioned, I have grandkids and I want to get them involved as citizen scientists. I'm seeing other people in the Q&A box saying, how can I help get my community involved, almost acting as a facilitator? So maybe we can start off with John for this question. So John, if someone wants to be a leader and get other people involved in a project like Project Sidewalk, what would be your advice to them?
Yeah, well, specifically for us, because we rely so much on community engagement and community leadership, both on the disability advocacy side as well as sort of the local partnership side, we've developed a new website called accessiblecommunities.org, which identifies sort of 4 different types of stakeholders. So for example, if you're a government worker and you're interested in these low-cost tools to help assess the built environment in your communities, if you're an educator, maybe K through 12 or particularly middle school through high school, I mentioned those Girl Scouts before, and you want to adopt curriculum around the built environment, disability, and public health, you might be able to use Project Sidewalk. And what we actually found with our Girl Scout deployment was that it actually changed not just their attitude, but also their behavior around sidewalks and equity. And so I think there's a lot of really cool curricular advantages of employing this, both on the data science side, as well as just developing good, enriched humans in society by allowing this to be in middle school and high school education. And then also certainly our disability advocates and community partners. And so this is a new website, it's accessiblecommunities.org, and it does try to detail and help people understand, because we realize we need to create almost zero friction to help people because everyone's really busy and sometimes disability is not top of mind.
100%. And I love the point about zero friction. I'm even seeing this in this event because I'm seeing more questions come in from people asking about things we already said. And I think this is true with all of us, with not all of us like the project, all of us like everybody in the world. We all have to sometimes hear things a few times, or we need like very simple calls to action to be able to get involved in a meaningful way. So I love that you're making that simple website for people to get involved. Before we ask about all of us again, one more question for you, John. I saw this come through in the chat. Can any city join Project Sidewalk?
Yeah, so I think ideally, yes. What we found in practice is that we really want to work with local community activists. And so that community partnership is pretty critical. And so we have like a list of considerations. Accessiblecommunities.org goes over this. But we also have this like little point by point. Here are some things you should think about. Because while Project Sidewalk does make it easier to evaluate the built environment, it still is a lot of work. And even then, once the data is collected, it takes a lot of persuasive advocacy, city council meetings or otherwise, to try to get the ear of leadership to invest in sidewalks. So in some ways, Project Sidewalk is part of a greater story. And we try to make that clear when people contact us. But we're very interested. We're in 21 cities, 7 countries, 5 different languages, including Spanish and Mandarin and Dutch and German. And we're very interested in these partnerships and growth.
That is a very diverse portfolio there. And anybody can, join Project Sidewalk and classify the data for all these, cities and different regions that, John has been working with. So that's very exciting. I know I really enjoy participating in Project Sidewalk. I think I'll take a virtual trip to New Jersey today and I get to help the folks there. So I think that's an inspiring call to action.
Or Taiwan, or Amsterdam, or Zurich, or
there you go.
Ecuador. So there's, so many different opportunities.
That's so exciting. So on the topic of all of us again, so I know folks are saying, how can I get involved? And some of the folks who are already involved are saying, how can I stay involved? So maybe Dr. Watson, since we're almost at the close of the event, you can review it for us one more time. What happens after somebody goes to joinallofus.org, and then how they can stay involved in the program after they initially join? Just walk us through that whole process again.
Thank you so much. So if you have joined All of Us and you are a participant, like Devin said, and you get that kit, you may receive information about, we encourage you to visit the website. When you log in, you get a unique login and a password that allows you to go onto the website to almost see, not almost, but to see the progress of your journey. So for example, you'll be invited to complete surveys and questionnaires. We just recently did a project that's an ancillary study called Exploring the Mind, where it's asking certain questions about mental health experiences with the healthcare system and just different questions about mental health. And we know that that's so important and how that can inform other aspects of our health. Our mental health is all a part of our holistic health. But for example, if you're All of Us participant, we encourage you to complete the request that we give you for surveys. We also encourage you that you may be at one of the sites that may have opportunity to think about enrolling in other aspects of the program, like the Nutrition for Precision Health program, for example. We encourage you to consider doing that. And then update your information, like if your address were to change, if your phone number or email were to change, to make sure you update that, because staying engaged in the program is so important. And then encouraging other family members and other friends to enroll in the program.
Fantastic. And we're almost at the close of our time together. So I think we'll have each speaker give their final remarks. So today's theme, Genes and Journeys, Bridging Gaps in Medical and Societal Accessibility. I would love for everyone just to say what they want to say about calls to action, what people should do after this program, anything that they want to share about citizen and community science. I think we'll be able to close us out with the Genes and Journeys theme. And if you don't mind, Devin, we'll start with you. Give us your parting words of wisdom. Yeah.
Oh, yes, I will do my best. No, I think one of the things that I want to impart is just how important it is to stay engaged with your health. I think as, when we're kids, we're always, we have our annual appointments and we have all of these things when you're younger. And then I think as we become adults and we get older, those things kind of fall by the wayside. And then all of a sudden, somebody that we know has cancer or somebody that we know has diabetes. And then it's like, oh my gosh, how does this affect me on an individual level? So just staying engaged with your healthcare and your own health journey is really important, especially in terms of genetics. To Dr. Watson's point earlier, I think the best way to stay engaged with the All of Us research program in particular is just that, stay engaged. Be ready for surveys and emails. And I know that a lot of people are like, well, maybe I don't want to know the big scary things, but a lot of times it's just taking that deep breath and getting ready for what it says, and then, following the journey to completion, whatever that means in terms of your own health. I think one of the biggest things that we need to remember is we are citizen sciences. We have bodies. We are made of mass and energy. And I think we all have the potential to do greater things if we just stay engaged with ourselves and our own journeys.
Inspiring. Charite, do you have any final thoughts on the Genes and Journeys theme? Any parting words of wisdom?
I think I'll add to Devin's comments and just say that in addition to staying engaged with your own health, to gather family history information. This is incredibly important information to share with your doctors. And sometimes we don't talk openly about disease and illness within our families. And I would encourage all of us to start those conversations, gather that information, and then take it back to your doctors and ask and share and say, this is what's going on in my family. Do I need to talk to a genetics provider about this? Is the genetic testing indicated? Because often there are steps that can be taken for prevention, but if that kind of bi-directional conversation isn't going on, it's hard to get the appropriate guidance in that space. So talk more in our families, share kind of along the demystify disease and make those conversations more open so that everybody that we love can benefit from that knowledge and information.
Yeah, I think that's been a guiding theme of today's discussion. It's that communication is key. If you don't know what to do next, the best thing you could do is just start talking to the people in your community. So on this Genes and Journeys theme, John, do you have anything else to add? Any parting words of wisdom for us?
Well, I've really enjoyed this panel and certainly learned a lot myself. But yeah, I suppose there's the journey of life and then there's our own mobility journey. And I think as we age, we all have different types of mobility and different types of needs. And it's useful to think about how the built environment both is conducive to that, but can also constrain it. And if you are interested in this, please do visit accessiblecommunities.org and hopefully we can change the world's sidewalks together.
Let's do it. And then Dr. Watson, any parting words of wisdom for us about the Genes and Journeys theme?
It takes all of us, and I truly do mean that. I'm like so excited for John's work. I'm excited to go back to our data set and find some scientists that are interested in looking in our 3-digit zip code data, for example, and seeing if there's any stories that our 3-digit zip code data can tell us about accessibility of sidewalks. There may be some cities that we can find out that may have a higher incidence of certain conditions that we even collect wearable data. But if we don't have accessible sidewalks and accessible walkable paths or paths where people with different mobility issues can get around in those communities, then we're missing half the answer. So it's important for us to get all of the answer by having all of us involved. Thank you all so much.
Awesome. I think that's another theme from today's talk, that there's a lot of work left to do and it takes all of us to do it. Thank you, Dr. Watson. So if you all enjoyed hearing from the speakers today, good news. If you haven't watched their lightning talks yet, you can find them on NNLM's YouTube channel, as well as SciStarter's YouTube channel and Facebook later today. So you can watch those talks and learn more from our speakers, about 10 minutes per talk. And also, Citizen Science Month isn't over yet, so you can go to citizensciencemonth.org and continue to participate in different projects. Even though we hit 1 million acts of science, let's hit 2 million. Let's keep it going throughout the whole year. And you can participate in all of us too, and that counts as an act of science, a really impactful one as well. So I'm going to pass the mic to my colleague Stefania to end the show today. Thank you so much to everybody.
Thank you so much to our panelists for joining us today. To our audience members, we want to thank you so much for joining. We hope the discussion will help jumpstart your interest in learning more about how you can help change the future of health by participating in research programs like all of us. We invite you to watch the Lightning Talks to learn more about the topics covered today. The program was made possible in partnership with the National Library of Medicine, the network of the National Library of Medicine, All of Us California, Arizona State University, and SciStarter. We want to thank the library partners and community organizations from around the U.S. for promoting this event to their community members. We welcome your feedback on this program through our online survey. A link is available in the chat. Your responses will help us continually improve our programming. Goodbye.